Well, good afternoon, Jamie. How are we doing?
Good afternoon. The weather has certainly changed. It is freezing today.
Well, this is the one of the longest fall I remember. There has been so much color. It has been amazing to watch. Amazing, all different flavors. So,
It
by the
is.
way, big deal. 3 days ago, World Diabetes Day. Your first cooking class, and also 10 years of our portal, our diabetes portal, my diabetes home. So, kind of November is always this month with this excitement of
It is.
Diabetes Month, Diabetes Day, and the birthday of our tech platform. 10
Yeah,
years. 10 years.
10 years. It's 1 decade old. It's now double digits. I love it.
Yeah.
It is Diabetes Month, Diabetes Awareness Month. We're doing a lot of things. So do check it out. There's several things that you guys can get involved with throughout the month. We've got a blog and an emailer that went out about some of those things. So do check out our blog. I can put a link to it later on some different activities that can be done during Diabetes Month. It's a big month for us.
And please, as you join in, please type in your name. Where are you from? Say hello. It's always good to have you guys with us. And it is a pretty exciting session. And
It
we are
is.
recording, and any comments you make afterwards, we will also be able to take care of them in case you're listening after hours.
Yeah. So it is 1 o'clock. Let me bring up our agenda for the day.
All right. Well, welcome everyone. Here's the thing. We're going to talk about ABCs. And as you know, if you lower your A1c, you can reduce your risk of complications. The bigger thing, though, that I want to talk about is the whole ABC. Did you know that only one out of people, five people in the US, are meeting all their targets of ABC? One out of five. Four out of five are not meeting. And today we are going to change that. Not today, we are going to start the change on that. So today, and by the way, hello to Stacy and Kathy. Thank you so much for joining us from Idel and Kenny. Again, please chime in your name. Love to hear where you're from. So, what are we going to do today? Well, we're first going to talk about the ABCs of diabetes. What are they? And, more importantly, why should I care about the ABCs? We'll talk about that. Then, how can I keep track of them? And the top three things I can do to control them. So, let me just take a moment to talk about why. The ABCs determine your how your control would be now and your risk for complications in future: eye disease, kidney disease, nerve damage, heart attacks, and strokes. The ABCs determine that. So if you want a healthy life, you definitely want to know more about the ABCs and take control of them. So that's what we'll talk about today. Let me introduce my partners in crime. Jamie Petlick, pharmacist, professor from Drake. Always good to have you, Jamie. Very passionate. We enjoy that energy. And by the way, hello to Cindy and Joan as well. Thank you for joining. And now for the speaker of the day today, I'm going to introduce Dr. Mark Johnson. I've known him for at least 20 years. And he has been changing diabetes for at least 40 years or more. He's in Mason City, has an amazing center, kind of this one-stop shop where education, care, complications, everything is handled. I'll let him talk more about that, but I look up to him for the work he has done, and I get some inspiration from him from time to time. So, Mark, it's an absolute pleasure to have you here.
Thank you for having me. It's going to be a fun day.
Excellent. Well, let's get started. And Jamie, you want to talk about TIL and then get us started?
Absolutely. So we're going to bring back Today I Learned, or TIL. So as you learn something new today, just type it in the chat. I'll be watching for that, and I might highlight a few things that you guys are learning. It gives us a lot of good feedback on what you guys are learning. And it lets us know how we're doing with our content. But also, I think it just helps create the excitement about the topic, and just to let everybody know that, hey, I'm not an I might be an expert, but I'm still learning. Dr. Bhargava, Dr. Johnson, they're still learning as well. So we are going to join in, and I might type out Today I Learned throughout the talk as well. I'm also going to bring up our first poll to get us started, give me a second as I change my screens and get everything going. So let us know, how often has your doctor or educator talked to you about the ABCs of diabetes? In the chat, you can either type the response, or you can type like never, or you can type A. Let us know. A, I've never been talked about it. B, maybe once. C, a couple of times. Or D, every visit. How many times have you been talked about the ABCs? We're getting a few to come in. So we're getting some saying never. Quite a few. And then we're getting some that are saying
Yes.
maybe once. So this is why this topic is so important. It's stuff that we, as the diabetes educators and the doctors, are working on your health. We're actually looking at these at almost every single visit. It's just sometimes we may not frame it in terms of this ABC, but this is a definite concept that you can take away. And so I'm going to let you guys take away and actually talk about the ABCs.
So ABCs. To be fair to our doctor colleagues, they do talk about it and think about it. Let's just say, what is ABC? So A is A1c, which is sugars. In diabetes, you want to control your sugars and have a better A1c. B is blood pressure, and C is cholesterol, right? So those are the three things. And just taking a moment again to say why. Why should I care? Well, it's just for better health. At the end of the day, it's not even the numbers. You have better numbers, you have better health. You will be able to do the things that you like to do with people you love for a long time. And that's really it's all about, right? ABCs don't even matter. It's your health that matters. If you control your ABCs, you'll have a long, healthy life. So at this point, I'll let Dr. Johnson kind of begin, teach us about A, and then I'll take B, and he'll take C.
Sounds really good. So we're off to a good start. So a lot of things to talk about. We'll try to be as practical as possible. So I'm pretty sure most of you that are on today either have diabetes or have a family member with diabetes. And so you have heard this term A1c. And so we throw this out a lot, and it's an interesting concept. And kind of how it arrives is that when you make in your bloodstream on a daily basis this thing called hemoglobin, the amount of sugar that's in your blood, and it's all the sugars, the term in the technical term is called glycate. They actually attach permanently to the red blood cell. And actually all sugars in your body, just not the glucose, but they all do this, and they attach. And it's interesting because the red blood cell has this life of about 80, 90 days. We know when it attaches, if you take and measure how much sugar there is over that average lifetime of the red blood cell, you can approximate what your blood sugar was for a whole 90 days. So I think that's a really good concept, and that's really good news. And before we had A1Cs, it was really hard to understand control for people with diabetes. So we're going to check that pretty much most of the time you see your physician. So people are doing quite well. We may not check it more than twice, 3 times a year. But if your sugars are high, we want to check that pretty often, usually every 2 or 3 months. So if you're doing well, you may not get it quite so often. But if your sugars are high, or there's a goal we're trying to meet, or changing therapy, we're going to check it more often, so to make sure you're on the right track. The other concept I just want to mention briefly is that those of you who have type 1 or a family member with type 1, there is this A1C concept, but there's also the issue of new sensor technology. So there's another branch of diabetes now that's looking at controlling your blood sugars, looking at sensor technology, which is another way to look at average blood sugars. I just want to throw that out there for those of us who are familiar or have a sensor on. So we actually have more data than A1Cs now because we can use sensor technology.
So I'll add a few things in. Mark, first of all, what goal do you recommend to your patient for A1c?
So the new concept from the American Diabetes Association, the last about 3 to 5 years, is this concept of individualized care. So we do know that the A1C target for most of our patients right now is to be less than 7%. but that can be modified significantly. And actually, the American Diabetes Association says if you can safely control your blood sugars without lots of low blood sugars, you can have a lower A1C. So sometimes we actually do want those low ones in the low sixes. And of course, there's special populations like our patients with pregnancy. We actually get our A1Cs really low, like in the low 5% range. But for most patients, it's typically less than 7. Now, our older patients, especially if you're somebody who has heart disease, we typically, on insulin therapy, we may let A1Cs be as high as 8% and be just absolutely fine with that. So you and your physician need to sit down and you need to know the individualized goal for you, because it may not be the same as you and the other people that are around you or people in your family.
Excellent. So the key of ABCs today is going to be the same theme. What's the right number? Well, it's personalized for you, and we'll talk about that a little bit more. So yeah, I would just add to this that if somebody is young, doesn't have heart disease, does not take something that can cause low sugar reactions, I shoot for 6.5. Otherwise, I go 7. And then I totally agree with pregnancy on one side, the elderly with heart disease on the other side. So that's the A1C. And lastly, on the sensor side, you will start seeing something we talk about more and more, especially in insulin users, time in range. So that's coming, but not for today. Today, that's all we want to talk about, the A. And again, if you guys have questions, please type them in. We will definitely answer them as well. All right. So the A1C has been studied in all these studies and shows significant reduction in complications. Now, let's talk about B, the blood pressure. So I would also ask just a quick poll here. How many of you are taking blood pressure medicine? Just say I'm taking one, two, none. Just type your number, 0, 1, 2, 3. So blood pressure, the bottom line of this is it's again individualized. A lot of people with diabetes, with weight issues will have blood pressure problems. So again, it gets individualized, 130 over 80, 140 over 90. Those are the two typical numbers you will see. Which one is yours? Really, again, depends on your risk. If you have a lot of risk factors, we start shooting for higher numbers. Like if you are older, we shoot for higher numbers. Heart disease is interesting. Many times I shoot for lower numbers, but sometimes because of all the comorbidities, I have to shoot for a higher number. In general, again, young, less risk, 130 over 80. Higher risk, okay, it's okay to be 140, 90. Mark, I'll tell you, these are guidelines, but I personally don't like 90 at all. Like there's no patient in whom I'm shooting for the diastolic of 90. What are your thoughts? How do you take it, Mark?
Yeah, I definitely agree with that. So you talked about specifically about people with cardiovascular disease, stroke or heart attack. Those patients need special attention. Also, even patients who have kidney disease and even patients with retinopathy, eye disease, you really want those blood pressures to be as low as they can possibly be safely. Now, if you stand up and you're dizzy and we call it orthostatic. If you're dizzy when you stand up, you're not going to tolerate a blood pressure, let's say 120 over 70. But typically younger patients, and I call younger anybody younger than me, which is like a lot of people. But if you're in your 50s and even 60s and you don't have a blood pressure less than 130 over 80, I think you should think about discussing with your physician if that's a possibility.
Excellent. By the way, a lot of people responded. I see none, which is great. Some said yes, and then there's somebody said 3. Blood pressure, once high blood pressure happens, it's typically to treat it optimally to target, it's a 2 to 3 medication disease.
Well,
So, like
Dr.
none,
Barber, I'll interrupt 1 second, but the average type 2 patient in this country right now averages 3.2 blood pressure pills per person. So there's a hypertension is a very hard thing to treat. Most people actually require multiple drugs.
and the good news is today we're going to talk about things that are not medications that will work on all 3 of them. So instead of taking 3 for diabetes and 3 for blood pressure and 2 for cholesterol, we will be talking about things that work on all of them. Well, let's get the C in, and then we'll go from there. So C is for cholesterol. Cholesterol typically doesn't lead to symptoms, but the issue is high cholesterol over time, and that might be yours. You know, I will let you speak about it. So, Mark, it's yours. Go
Yeah,
for it.
right. So again, the recommendations that we follow, at least in here in Mason City, I know Dr. Bargava does well, and most providers who take care of people with diabetes, we follow the recommendations of the American Diabetes Association. And so they recommend that we be fairly aggressive. What's changed the last decade is we're not so keying in quite so much on getting numbers. We want to achieve the best cholesterol we can get, and that would definitely be a goal. So keeping your LDL or your bad cholesterol, so it's a little mnemonic here. The L is for lousy, so you can remember that, because people have a hard time remembering these good and bad cholesterol. So this low density or a bad one, it should be less than 100. And there really is no low range that's too low. So you want to treat this thing as aggressively and as low as you can possibly get it. If you have heart disease, for example, or a stroke, you want this thing to be low. So the next we'll advance it to the good one, which is the HDL. And so another way to remember a happy mnemonic is this happy cholesterol. So I think it's a great way to remember this. So we want our HDLs to be high, and the better, the higher the better, for the most part. So you want your cholesterol to go up. So we're going to talk in just a minute about exercise, but one of the things that's most potent increasing HDL is daily or adequate exercise. Drugs don't do a very good job of this. Now, triglycerides is this other happy player we have, and triglycerides are what you get is when you eat a Thanksgiving dinner and you have the gravy on top. That's what triglycerides. It's this free floating fat that's in your bloodstream. And that's not a good thing to have either for lots of reasons, but we want to keep it less than 150 for the most part. That's a hard challenge with diabetes. Not all patients can achieve that. I would say my personal opinion is that, but A and B are more important than C. And if your triglycerides are 200 and you're doing the best you can not to eat fat, I would not lose much sleep over that. But you do want to keep all these values as good as you possibly can, which leads to the one last comment that I want to make, and I don't forget to say it, is the concept, what I call the best you can do. So if you're doing the best you can every day on your diabetes, whether it's A1c, blood pressure, or cholesterol, and you're really doing the best you can, and it's not quite the number that you want to achieve, you know what you're doing? You're doing the best you can, and you should be okay to do the best you can.
Well, that's great. I'm glad I'm getting an echo of myself. I'm glad you said that. Do the best you can. The effort itself, the process itself has benefits. So people do exercise, they don't lose weight, fine, but they do feel better. But most importantly, they have better quality of life and they live longer. So just think about that, that there are silent benefits of doing the right thing. Well, we've talked all these numbers. It's a lot of numbers. Diabetes is 24/7. And I noticed Stacy's comment about atorvastatin. Do I need to do something? We'll figure it out. I'm continue to get an echo from time to time. So all these numbers, but again, it's really not about the numbers. It's about you, your health, your quality of life, and it's about you being able to do for a very long time things that you like with people you love. So this is all about that. And today we'll talk about top three things to do. But I'd like to also hear the why from Mark and the why from Jamie. Jamie, why should people care about the ABC?
To me, it's all about feeling good. Caring about the A1c, it's all about the future of keeping you as healthy as possible. We don't just want to add years to our life, we want to add healthy years to our life. And if we're focused on eating healthy, maybe exercising, keeping those numbers lower, that's going to add to healthy life.
All right, let's go into, and Mark, you want to add anything else?
Well, just one small thing, and because I didn't quite complete the cholesterol discussion, just to make sure that there's a bad rap for statins out there. The internet is full of all the terrible things about statins. It's going to get to what I'm going to answer, that I absolutely agree with Jamie, that this whole thing about quality of life and what we do every day is about that. But the analogy I'll make to like using statins and doing the best you can every day is about the same concept of why you change oil in your car. Do you change oil in your car so it goes faster, that it starts better? No, you do it for one reason, so your car will last a whole lot longer. And you don't have to change oil in your car, your pickup. It'll last for 3, 5, 6, 7, many, many years until one day you start up, the cylinder seizes, the piston seizes the cylinder, and the car is ruined. So all this LDL reduction, the blood pressure, eating healthy, exercise, It's about this quality of life that Jamie's talking about. And your parts last a whole lot longer. So it's not necessarily how long you live, but when you're 85, you want to be in really good shape.
I absolutely love that analogy. I mean, that paints a great picture for me. I do have a question. I'll aim it at either of you. It's coming from Kathy, and it's about our triglycerides. Are they coming from saturated fats?
Mark, you or me?
Go, you can start. Go, you can start.
So the saturated fats versus unsaturated. So saturated are the worst fat. When you look at your diet, you want to do less of saturated, more of the poly and mono. So that's one thing. Does that correlate directly to triglycerides? Bad things come packaged with bad things. So if you're going to have things higher in saturated fats, it's likely going to change your triglycerides up. Now, triglycerides are a combination of what you eat both on the fat side as well as carbohydrate side. So you just have to think of this combination. That's the diet. A calorie-rich diet that is abundant in fats and carbs will raise your triglycerides. Alcohol raises triglycerides quite a bit. Remember, our body converts everything into everything else. But when there is abundance of calories, start doing the bad things: high cholesterol, high triglycerides. So there's a correlation between consuming food rich in high in saturated fats and having high triglycerides.
Okay.
Thank you, Kathy, for that question. Our first question of the day.
Yep. Thank you, Kathy. We can always count on you, I think. You always ask great questions. I've got a question for everybody. If my poll will advance, let's see. How do you keep track of all of the numbers? The doctors give you A1Cs, they give you blood pressures, they give you cholesterol. How do you keep track of it? One, you don't. You sometimes write them down. You put them in, if you're like me, I put everything in a file, kind of file it away, and I say someday I'll look at it. So I'm a C. D, I have a spreadsheet, or I use my doctor's portal, or I have an app or a website. Let us know how you guys are tracking it.
I sometimes, I don't know, I sometimes think of them. I sometimes have the paper file somewhere. I would love to have a spreadsheet or a website, but yeah, I don't do it.
I'll tell you, my father has a spreadsheet, and that's how he tracks everything.
There we go.
That's his
Folks,
brain.
we're interested in hearing how you track. All right.
So we've got
Dr. Portal. Cindy says, file at home. Yes, I do that too. Actually, that's the one I do.
Yep, that's mine.
Excellent. Well, I think so. Kathy says E, my doctor's portal. So that's cool. A lot of people are talking about the portal. So, Jamie, do we talk about this now, or you want to talk about the top three things first, right? I can go about tracking later on.
If you want to, I think we were going to talk about tracking later, but as long as we get to ways to easily track, we've got some different ways that we recommend to easily track, but we can also go into the top three.
Let me just show it at this point. We've asked people, so I will say at the end of the day, you want to bring everything together in one place. And I've been trying to find the answer to this problem myself. So I have built the solution, My Diabetes Home or Iowa Diabetes Portal. As a reminder, in Iowa, it's available to anyone for free. Outside Iowa, it costs about $3 a month or something. But in Iowa, we make it available to everyone for free. So this does the ABCs, so my numbers. Here's the A1c, and it color codes it as well. You can do manual entry, or you can connect your doctor's EMR. So, and I'll share that in a minute. But you can see this over time. Then, of course, your blood pressure, same thing. You can put in and track over time. Everything is color coded. You can also download it from your doctor's office. It gives you the goal and so forth. Similarly, C for cholesterol, same thing. So it brings everything together in a color coded fashion. You can also monitor your weight and so forth. There are so many numbers in diabetes that we created our own number. We call it the DISCO. And I like dancing, so DISCO diabetes score. And it's a composite number of all ABCs and many more things. So, and my belief is this truly determines people's health, how well they're going to be many years down the road. So I have some people who compete on getting a better disco and so forth. The last thing I would say is this platform also allows you to calculate your risk. We didn't touch on this, we gave numbers today, but frankly, your 10-year risk determines how aggressive we are with your statin therapy, for example. So you can calculate your 10-year risk and so forth. So there's a lot of information here. And the last thing I would say is nobody wants to enter the data themselves. And this is where you can really add your healthcare provider, your pharmacy or lab here as well. So let's say if you want to find Unity Point here or Iowa Clinic, you just search, find Unity Point and connect. You'll need your username and password. So I saw several people doing the doctor's portal. The only downside of that is that's just there. It doesn't let you massage the data. It doesn't let you share with others and so forth. So that's our way. That's how we recommend our patients track our ABCs. And that's all I'll say. Anybody make my day? Is anybody using this portal? Yeah. Well, we'll find out. But let's go to the most important part of this. We talked about ABCs and how to track, but now let's talk about the um, how to control these ABCs. So let's ABCs. Jamie, could we go into that before this poll then? And
Well, so we wanted to hear from them which one, and we can start talking about the top 3 ways to do it. But I also wanted to hear from them which ABC is most important to them. So, which one is most important to you? We will talk about ways where you can work on improving each of these. But as we're talking about it, type in, let us know. Are you focused on the A1c? Are you focused on the blood pressure because you have heart disease? Let us know which one you focus on mostly as you're working on your lifestyle.
excellent. So please put in, and in the meantime, we'll start. So, Mark, tell us what's your number one thing you want people to do that can impact all three.
Well, I want to talk about briefly about exercise. I have a real bias because I happen to have 2 adult sons who are strength coaches. So I'm really into strength and conditioning because it's in my family. And I read the literature about that. And if you look at the literature, actually, the American Diabetes Association suggests some type of exercise that is based on weight training for all patients, not just the 30-year-olds and the 40-year-olds and 20-year-olds, but even the 80 and 90-year-olds. So I'm a big advocate of doing some type of strength. So I would think about that, and I would think about doing it most days. This whole thing about exercise, American Diabetes Association specifically says 150 minutes a week because there's research. There's a study that showed that particular number dropped your A1c about 1%. If you think about what drugs do, most of our drugs that we add on, typically other than insulin, drop your A1c about 1%. Well, this drops your blood sugar 1%, 150 minutes a week. So you need to do that every week. So I think exercise is key. I think the people who just do diet and don't do exercise certainly don't feel as well. I think their quality of life is not as good, but they're also just cheating themselves out of an opportunity to improve all the A's, all the B's, and all the C's.
Excellent. And what I would say, my modification to that, I totally 150 minutes a week, fantastic. Something that gets your heart rate up or makes you sweat would be nice. But begin slowly, talk to your doctor about it before you start an aggressive exercise program. Strength training, absolutely essential, and I would add stretching to it. So, once a day, do at least one of the 3 things. And yeah, so I agree. Exercise is pretty cool. I did notice Jamie and Joan talking about A1c being the most important. And then let's look at Stacy's comment, heart disease, tense, and you worry about diabetes. Yeah, understand. So you've seen the B and C determine heart disease the more. So yeah, just make sure, Stacy, your cholesterol is well controlled, and that, yeah, it's good that you don't have high blood pressure. Excellent. Well, I'll take one. So we said we'll give you top 3 ways. So my way is more about food. And I do believe food impacts all 3 of these things as well. And again, food by itself can be a huge lecture of its own, but I want to talk in the context of food. So just a healthy diet. And I'll tell you, for either exercise or diet, do something that you enjoy. I want to make sure there's a joy in making these lifestyle changes. So my number one rule of lifestyle changes is do something that gives you pleasure or joy so that it can last a lifetime. That's the food part. Controlling the portion size is critical. The number of calories each day, that's based on age, weight, and how active you are. Um, Distributing your carbohydrates in diabetes is very important. Um, there's no never food in diabetes. Okay. There's no never food in diabetes. It's just the portion that matters. It's the frequency that matters. The Think about healthier foods. So things that are less processed are healthier. The most processed thing, like a fried chips or a steak, they've been processed over and over. So just stay away from those. Go with plant-based nutrition, less processed. So vegetables, it's hugely missing in our diets. Vegetable, fruit. My thing is 1 to 2 serving each meal should be one of these two things: fruits and veggies. Have a colorful diet. The colors mean that they are less processed and they are from a healthier groups. So those are some of the things I would say. Work, if you can, work with a dietitian to have a plan for you. We are super excited that on December 2nd, we have Sabina joining us. She's a registered dietitian, certified diabetes educator, and we are going to make a lot of new things happen in early next year. And there will be plenty of free group classes on nutrition from her. So please stay tuned for that. Jamie will keep you guys informed. So diet again will impact your A, B, and C, all of them. Let me talk about a specific thing on B and diet. So salt in our food determines our blood pressure. So the less salt you have in your diet, the lower your blood pressure. There's an amazing diet called DASH diet, a dietary approach to stop hypertension. So a lot of my patients, I recommend that. So people who are taking 2 or 3 medications, go on the DASH diet. So I know I could talk about nutrition all day long, but let's just finish here with some highlights. Jamie, there's 1 or 2 important things you want to say on diet and exercise. You can.
Yep.
Otherwise, tell us
So
what.
we only gave you 2 right now. We promised top 3. I'm going to give you the last one. And they saved this one for me because I am the pharmacist. If your doctor or healthcare practitioner or diabetes educator is recommending medicine to help you with the control of your diabetes or your ABCs, taking your medicine as prescribed is the third way to help with your ABCs. That's an entire talk in itself, but that is the third way that it can do it. So when I talk about controlling diabetes, or actually when I talk to patients about blood pressure and cholesterol, it is diet, it is exercise, and it's medicine, and it's all 3. And it's all 3 kind of combined together. Some people can do more diet, some people can do more exercise, some people need more medicine. And it's just the combination of all 3 that help you control all of that.
Let me bring ABC together in one way. Um, Again, these numbers matter, but are there common things that you can do to make the ABCs easier to achieve? There's one thing I would talk about is change your environment. If you change your environment, all 3 of the diet, exercise, medications you could do better. Let me just give one example in each scenario. Exercise. You wake up in the morning, you don't feel like exercising. All you do is just get in your exercise clothes. That's all I'm asking. Leave them out. You wake up, get in your exercise clothes. It will substantially increase your frequency of exercise. Environmental cue, much easier to do. Food. You have trouble with eating the bad food, just don't buy them. Go buy things on a full stomach. Then you'll make healthier choices. If you bring healthy things at home, guess what? You're going to eat healthy things. Change your environment. C, cholesterol, same thing. The medications, the medication side of things. Change your environment. I have trouble remembering. I was at somebody's home this weekend. Pills are hidden in the cabinet. Insulin is in the bathroom. No, I made sure, let's bring it all together. If you
Right.
take it twice a day, I set alarms on your phone, and here we go. Have everything together in front of your eyes if you safely can. So sometimes we think it's a willpower issue to do diet, exercise, meds. No, it's not. It's really not. It's about changing your environment. So I strongly recommend focus on changing your environmental cues. Mark, what would you like to add?
Well,
Or
I couldn't agree more. Make it easy. I mean, take your instant out of the refrigerator, put your medicines out where they're easily accessible, set your alarms on your phone. We do that day after day. I do just want to say one thing though. We don't try to say no. We try to do the positive in the diet. But I do tell my patients to leave the crackers and chips at high V, because if your crackers are in the house, you're going to eat them. If your potato chips and your tortilla chips in the house, you're going to eat them. Just some simple things like that actually goes a long, long ways.
excellent. Jamie, to you.
I had trouble getting myself off of mute. Sorry. I agree. I ditto everything. My motto is out of sight, out of mind. And then mine is always the portion control. So not eating directly out of the bag or buying smaller portion sizes. So if you are going to bring the chips home, bring them in the individual bags and then eat only that individual bag. And never eating directly out of the big bag, but putting it into a bowl or making sure that you're only eating that portion size and not going back for seconds.
Excellent. Well, let's bring it home. It's time for Today I Learned. So, everybody, please type in what is one key thing that you learned from today. Jamie, you want to begin with what you learned or
Well,
something?
I've been typing mine as I went. I just reiterated there is no never food in diabetes. It is all about portion and moderation.
Excellent. As we were prepping for it, I learned from Dr. Johnson about it said A1c only 90 days, but the fact is, if clinical situation warrants it, insurance will approve it. Means I would do it. The question is, will insurance approve? And if it's uncontrolled and patient needs it, insurance will approve it. So that's something I learned last week. That was good for me.
And just a reminder to the audience, we want to see what you're learning as well. We've got a couple of people typing in right now. So I love this one. I love that this is what you learned today.
Excellent.
This is great.
Excellent. Others, Kathy, Joan, tell us what's your take home. Mark, what's your today I
Well,
learned?
well, I love that, and echo the joy of living. If you don't have joy in doing what you're doing, you're not going to do it. If you don't make it easy, you have to have something that you actually enjoy doing. It's not about what you can't do; it's what you should do. So, your Dr. Barger, your positive spin, it goes a long ways. I try to do that every day. I don't think I do it quite as joyfully as you do, but I'm going to be empowered now to go be very joyful with my patients.
Excellent.
Excellent.
Well, great. Well, let's summarize this and bring it home. We just kind of summarize with our key take home. What I'm going to say at this point is it's not the ABCs what we're talking about, it's your health we're talking about. This is why you want to care about your ABCs. So that's all I want to say. You have a take home message, Mark and Jamie?
I took my take home message already. There is a quick question. It sounds like it's a partial question on there. It is coming from Stacy and it's about Ozempic, saying that ever since being on Ozempic, she's not felt like eating. I'm eating much less than I used to. And I would say that that's exactly what Ozempic's job is. So Ozempic, part of his job is to make you feel full and make you feel full faster than what you normally do. And it takes away some of those cravings and in between snacking. So that's the Ozempic doing what it needs to do to help you. So I'm hoping it's resulting in some good stuff for you. It's a great class of medicines.
I like what Cindy and Jamie James say. Mark, this is hats off to you for saying this, making sure the best I can do, or like you said it, if you are doing your best, you're doing your best. And that's an awesome statement as well. And then Joan, you sum it up with ABCs. So everyone, thank you so much for joining today. Jamie, what's in the hopper for future?
So we are going to continue with some smaller shows for the next month or so. We're gearing up for the holiday season, so you'll see us talk more about holiday foods and some healthy options to eat as we gather somewhat for the holidays with our immediate families. So we'll be talking about that. We'll be continuing to write on some of our blogs, but then we are ready to get through this holiday season and start making 2022 as healthy as we possibly can be.
All right, Mark, thank you so much for joining us
Thank you.
today.
It was a fun
Um,
afternoon.
yeah, everyone, have a great day. And thank you for joining us in our quest to change diabetes together. Have a great day.